I'm Carol Andrews for another episode of Southwest TV News. Here are some of the stories coming up on today's show. $4.3 million has been allotted by the government of Saskatchewan over the next 12 months to establish collaborative emergency centres across the province. Funding, which is crucial to a similar primary healthcare model already in development for the community of Shaunavon. The calendar may indicate spring has arrived, but Old Man Winter does not want to let go of its grip on Saskatchewan. State representatives of the late Jesse Alberta Grant recently joined Cypress Health Region and Dr. Noble Irwin Regional Healthcare Foundation representatives for the grand opening of a new covered walkway at the Cypress Regional Hospital in Swift Current. Thanks for joining us here today. Providing 24/7 quality health care for the residents of Shaunavon and area continues to be a top priority for the Cypress Health Region. And in this report, we bring you an update on a proposed project for that community. $4.3 million has been allotted by the government of Saskatchewan over the next 12 months to establish collaborative emergency centres across the province. Funding, which is crucial to a similar primary healthcare model already in development for the community of Shaunavon.
We already knew last year that we were getting some funding. We received a small amount last year, and that will continue into this year for the development of a collaborative emergency centre. And of course, the priorities that we've set as a provincial leadership team with the Ministry of Health are on three areas, and that is on the Sask Surgical Initiative, it's on primary health care, and it's in the areas of safety for patients and our staff. So, that really fits with the priorities that we have. Collaborative emergency centers really are based on a model of just a foundation of good primary health care.
Vashon says the process is well underway by the Health Region to get this new model of healthcare up and running at the Shaunavon Hospital, with a few crucial steps still to be solidified.
We are, of course, in the midst of continuing to recruit for physicians and a nurse practitioner. We have actually had some interest from nurse practitioners and in the last little bit, and again, there's some possible candidates out there. We have a physician who will be completed a SIP assessment by the end of May, and we expect that he'll be joining us in Shaunavon shortly after that. We are renovating the hospital at this point so that we have a location for physicians to come to work in the community of Shaunavon, and that they will be in a, again, collaborative environment where they're working with the whole team, not just another physician potentially. So, we're making some good progress there, but of course, we're not going to be able to get anything started until we actually have people on the ground who can provide the service.
The Cypress Health Region hopes to have the new model of primary health care in place for residents of Shaunavon and area in the next several months, with an overall goal of providing 24-hour, 7-day-a-week health care and emergency coverage.
Hello?
Hey, Mom. Chris has a fever, but I can't remember the number for Healthline.
They just changed it. The Healthline number is now 811.
That's easy. Thanks, Mom.
Healthline 811. Professional health advice 24/7.
Trust the team at Pinnacle Financial to help you reach your financial goals. Whether you require personal or corporate income tax planning, bookkeeping, management consulting, or full-service mortgage brokering, our expert team has you covered. Contact us today to begin your climb to the top.
Weather and road conditions can change quickly here on the prairies. And in this report, we take a closer look at what motorists should be aware of when advisories are issued. The calendar may indicate spring has arrived, but Old Man Winter does not want to let go of its grip on Saskatchewan. Heavy snow drifts and blowing snow forced the closure of numerous highways in the province this past week. And despite the ongoing updates from the Highway Hotline, RCMP, and the media, many motorists still try to venture out to their desired destination. According to the Highway Hotline, when road closures are initiated, a number of procedures take fold.
On major highways, like for example on Highway 1 this week, like in the Swift Current area, we had variable message board signs on the highway informing motorists of the closures. There was one as far west as Highway 21 at Maple Creek. In addition, like the RCMP were set up east and west of the city as well. We also use, if RCMP aren't available, we sometimes use our transport compliance officers. The issue is there's always ways around that. We cannot barricade every approach, every grid road, every municipal road, right? And so that's the problem we have is even though we're telling people the road is closed, and when visibility is below zero, by the way, that also means that our crews aren't out there. There are still people that will go around barricades and try to drive down the highway.
And if motorists do decide to avoid all warnings and still head out on the highways, Wakabayashi says this is not a wise move.
Two more serious conditions that we post on the highway hotline are road closed and travel not recommended. And those phrases mean exactly what they say. If RCMP or one of our snowplows needs to be dispatched to assist someone that's stranded, that's taking resources away from clearing the roads.
Motorists should also obey the rules of the road when it comes to following snowplows on the highway for everyone's safety.
When people see the snow cloud or the orange flashing lights, we ask them to slow down. The snowplows will pull over roughly every 10 kilometers or so to let any traffic that's queued up on them by, so there's no need to try and pass a snowplow. And one of the issues we do have on four-lane divided highways too is sometimes people just assume when they see the snow cloud that the snow plow's in the driving lanes. We do plow the passing lanes as well, so that's something people need to look out for as well.
And as many Saskatchewan residents know, April can also bring the odd snowstorm. Therefore, words of advice from the Highway Hotline should be kept top of mind for the coming weeks. The following is a paid political commentary by David Anderson, MP for Cypress Hills Grasslands, and does not in any way reflect the opinion of Southwest TV News.
This is David Anderson, your Member of Parliament for Cypress Hills Grasslands. Welcome to the Anderson Report from Parliament Hill. Sharing information about issues with you is very important to me, and this is another way of doing that. Saskatchewan's economy continues to be very strong. The latest economic indicators from Stats Can show our unemployment rate is down even further to 4%, which is basically full employment, while employment numbers are up by about 1.5%. Manufacturing continues to be strong, and resources and agriculture both underpin our economy. Our federal government has been able to work with the provincial government to lower taxes and to create opportunity. One of the issues that we've been concerned about has been the integrity of the EI system. Every year, hundreds of millions of dollars of EI contributions are lost because of ineligible or fraudulent payments. For more than 3 decades, Service Canada's Integrity Services Branch has investigated suspected fraud under the EI Act. As a result, $500 million in ineligible payments were discovered last year. But the EI system still lost hundreds of millions of dollars because of fraud. Recently in the House, the opposition have questioned and tried to stop the government's attempts to root out false employment insurance claims. You know, the only people who lose if the opposition stops us from auditing and getting rid of employment insurance fraud are the honest residents of Cypress Hills Grasslands who pay their premiums and who follow the rules. We will ensure the integrity of the employment insurance program even as our economy continues its strong performance. Until next month, this is David Anderson, Member of Parliament for Cypress Hills Grasslands.
A new covered walkway is officially open at the Cypress Regional Hospital in Swift Current, following a ribbon-cutting ceremony. State representatives of the late Jesse Alberta Grant recently joined Cypress Health Region and Dr. Noble Irwin Regional Healthcare Foundation representatives for the grand opening of a new covered walkway at the Cypress Regional Hospital in Swift Current. Details of the initial funding were announced last June by the Healthcare Foundation, which was the benefactor of the donation, with the decision made to allocate some of those funds to the addition of a covered walkway at the hospital, which was absent during the initial construction of the facility 6 years ago. A structural addition which is pleasing to all.
It looks like it was part of the building to be started with, and I think it's a very, very nice legacy to be leaving.
It's a long way from the drive to the front door, and especially on a day like today when you have snow and sometimes you have rain. So we've just had a lot of people complain about that long walk, so it's tiring, and then in the elements. So now we've protected them from that.
And with over 600 visitors through the hospital entrance on a daily basis, the covered walkway's unique design for climate control will serve clients and other hospital patrons well year-round.
The extra long overhangs and so on were done and the rounded roof, for that matter, were done for sun patterns. And I think quite ingenious when you think about it, because it helps to warm it when it needs to be warmed and helps to cool it when it needs to be cooled.
And donations of these wheelchairs and benches will also be added to the walkway entrance in the coming weeks. The covered walkway is just one of the many projects the Dr. Noble Irwin Regional Healthcare Foundation is involved with across the region, thanks to the generous support of various donors who purchase medical equipment, furnishings, and other items for healthcare facilities across the Southwest. Well, this brings to a close another episode of Southwest TV News, reporting the stories that matter to you. We always welcome your news tips. You can always reach us here by phone at our studio or by email to contact us at southwesttvnews.com. Also, be sure to join us daily online for the latest news from across Southwest Saskatchewan and so much more at mylocaltv.ca. And be sure to follow us on Twitter and Facebook. Thanks for joining us here today. I'm Carol Andrews.